right. All right. Hello again, STEAMers, my scientists, my technologists, my engineers, my math people, my art people, all of you. It is so glad, I am so glad, excuse me, to have you tune in. Um, I'm all smiles once again because we will be talking to a college friend, Dr. Reed. And in our pre interview conversation, it's just so, I'm gonna use his word, refreshing to see Dr. Reed on his shirt, because I remember when we first walked onto the campus of Prairie View, we were young, just didn't have a clue, just starting the journey of pre-med and pre-dental students, and the road seemed so long, but here he is, Dr. Reed. How are you today?
I'm so well, Miss Davis. Thank you for having me. It's an honor to be here. It really is. It really is.
So, Dr. Reed is a dentist, and he is going to tell us a little bit of what he does, if there's anything special, because a dentist is not just a dentist, maybe a little bit about the dental life. And, he's going to give us some tips, some tricks, some, information as to those who are aspiring to be that. All right, go ahead and introduce yourself, Dr. Reed.
So my name is Armando Reid. I am a DDS, or a doctor of dental surgery. I practice in Leander, Texas. I have a new office that I opened in August of last year. And I basically do family and cosmetic dentistry. Um, I did a residency for a couple years after dental school, so I pretty much do just about everything there is in dentistry, from orthodontics or Invisalign. I move teeth. I can take out wisdom teeth like an oral surgeon. I can do root canals like an endodontist, crowns, fillings, dentures, you name it. So I'm basically a one-stop shop. Um, and we're out there for families from little children all the way up to seniors.
Oh, wow. I'm impressed. One stop shop. That is very impressive. I mean, I know what that means, but just enlighten us a little bit of what do you mean by that one stop shop?
So when it comes to your teeth, most people will get a cleaning every 6 months, or they may have a cavity that needs a filling, and that's when they go to a general dentist. And so in dentistry, you can have, obviously, more can go wrong than just a filling. So there are about 7 different specialties in the dental field.
Okay.
So there's a specialty for removing teeth or extracting teeth, and that would be the oral surgeon. There's a specialty for your gums and the bone and everything that supports the teeth, and that would be a periodontist. There's a specialty for replacing teeth. That's called the prosthodontist. And so each one of these fields is just focusing in on a different aspect of dentistry. And every general dentist, when they're trained in school, they kind of train you to understand all of those different fields of dentistry. Um, but not everybody enjoys every aspect of it. So
Mm.
you can find a general dentist that doesn't like to deal with dentures, or a general dentist that really isn't good at root canals. They may take too long. And so a general dentist, sometimes they do a lot, sometimes they do a little. But if you specialize, say I specialize in root canals, which would be an endodontist, that's all I do every day is root canals, root canals, root canals. From the easiest root canals to the hardest root canals. And so for me, I prefer to have a variety. I like to do a little bit of everything. I prefer to have my patient come and see me, and me not have to send them anywhere else, because I trust myself to do the work, and Lord knows what they're going to encounter if
Mm.
they go somewhere else. And unfortunately, the specialists, they have more training in certain areas, and so they tend to charge higher fees. But as long as you, as a general dentist, have the same training in that field to do what they're doing, I'm fully licensed and ready to go. And so we provide, the standard of care um, that is at the top of the field. We don't half step it. We don't kind of get by. We make sure that the work that we do lasts. For example, I have a lifetime warranty on the work that I do. That's almost unheard of in the dental field. So
Wow.
if you needed a crown and I put a crown on your tooth, I would look you in the eye and I would say, as long as you're coming back for your cleanings every 6 months, this crown is guaranteed for life. Okay. Because if it's done right, it should last. Now, yes, things do break down, nothing lasts forever. But it's not only that I want to make sure that they're coming back to me, but I want to establish a relationship of trust
Hmm.
between the patient and the doctor, which is it's hard to find these days, let's be
Yeah.
honest.
I need you to move to Arlington. That's what I need you. Because that is so true. I mean, just I mean, oh, this is gonna sound really bad, but it's the truth. My wisdom teeth have never given me a problem except for, the fact that they needed filling. So, um, every time I go to the dentist, she says, "Well, you really should get them out," and and I'm like, "No," because when I go and I try to find someone, even the person that they've recommended, all it takes, Armando, is that one bad review to make me feel like, oh no, I can't go there. I mean, oh my
Right.
gosh. So
Yeah.
yeah. I mean, oh, it just takes that one bad review because I'm gonna be put under. I need to be able to trust.
Yes.
I mean, you know how people feel about the dentist anyway. So, oh gosh, yes, we are.
So difficult just to walk into a dental office.
Right, right.
And it's funny what you said about reviews because my whole motto is to bring five-star service to patients. So
Hmm.
um, every review that we have on Google Maps, you can look right now, it's 5 stars. And a true story, one time we got a 4 star from a patient.
Okay. All right.
I almost flipped out. I said, wait a minute. I, I called the patient personally. I said, ma'am, I noticed that you gave us a 4 star review, and I wanted to make sure that your appointment went well, if there was anything else that I could do to make your experience better. She told me the 4 star button was a little too close to the OK on her phone. She meant to give us 5. So she fixed it later on that day. I'm trying to tell you,
Okay.
if you got less than 5 stars, then they may not be paying attention to you as the
Oh.
as the customer. So I
Well,
hear
for me, it wasn't even just the I mean, the comments. A lot. I mean, I'm just like, no, I just couldn't do it. So, tell us, please, about your journey. We know, or some people may not. Um, to become a dentist, a doctor, it's a long journey. And, most people are deterred by the length of that journey, by the obstacles in that journey. Or tell us about your journey. How did you get to where you are?
Um, well, after graduating high school, um, my dad was always saying as I was growing up, you're going to be a doctor when you grow up. You're going to be a doctor when you grow up.
Okay.
And so I found myself at a summer program at Prairie View A&M, as you know,
Mm-hmm.
PCI, and it was basically like a pre-medicine program where you start to get all your sciences a little early. And I was just kind of going along to get along. Oh, this is what we do when we graduate high school, go
Mm-hmm.
to college. And, so I was taking the courses, I was having fun, kind of hanging out, living the college life. And after a couple years, I started to go to school part time and started to work, kind of do my own thing, felt like I was grown.
Okay.
Didn't really didn't feel the necessity or the pressure to go on to the next step after college. So I took my time, got married early, but we were kind of like girlfriend, boyfriend, girl, you cute, I like you, let's get together. And so we just kind of took my time working through undergrad. And then one day I got a call from my mom and she was like, boy, what are you doing with your life? And I'm like, what do you mean? I'm living the dream. And then I thought for a second, like, oh yeah, it's not just undergrad, you should have a plan. Like, why are you going to undergrad? and do that, because so often kids will go to undergrad and it's just for fun, and a lot of times we don't even graduate, or we graduate but we don't have a plan. And so it was that moment, maybe close to my fourth year, where I was like, okay, I need to have a plan. Let me get it together. So I started looking at all of the medical professionals, optometry, chiropractors, medical doctor, of course, and dentistry caught my eye because they seem to have the easiest path to being your own boss, meaning you could go to dental school for 4 years, and in most places you could get out and start practicing or open your own business. Well, at least that's what I thought. So I applied to several dental schools, and my favorite dental school was Howard University. I didn't know much about Howard University except for I saw the sweater on the Cosby Show all the time, and I said, "Well, I need to be at Howard because it's on the Cosby Show." So,
Oh my gosh. Yeah,
so,
we're just so clueless, but go ahead. We were
oh,
so clueless.
so
Yeah.
true. So, needless to say, I applied to Howard, and they asked me to come out. I did an interview, and they asked me to do another summer program. I was very familiar with summer programs because I did one at
Mhm.
Fairview. And it was kind of just like, because I had taken my time to get through undergrad, they wanted to make sure I had what it takes. So they threw a couple, courses at me for that 6-week program to see how I did. And then sure enough, I got accepted. Howard University, 2005, College of Dentistry, I'll never forget. And just went to work. Dental school was intense.
Okay.
Wasn't like undergrad where you could kind of, study a couple days before the exam and you're good. In professional school, you really have to learn and understand,
Mhm.
the material. So
Wow.
you get a textbook and you're not just reading a couple pages of it. You end up learning the whole textbook, okay?
Mm.
And so it was tough, it was challenging, but everybody that you were in it with was in the same struggle. So I ended up developing a lot of relationships in dental school, and toughed it out, got through. After the 4 years, we had to take our boards. And that's when I started looking at where I wanted to live, where I wanted to work. And there's a couple states in the United States where you have to have a residency program or serve for a year at a hospital or clinic, kind of getting additional training before they let you go out into the world. So New York State was one of those. And so I moved to Brooklyn. I did a residency program at Woodhull Hospital. It was about 12 newly graduated dentists, and they had a large dental clinic where they would see, whether it was Medicaid patients or emergency patients. Um, but that dental clinic was always hustling and bustling, if you can imagine Brooklyn. And there were a lot of personalities, I had to learn how to
Wow.
deal with, which was really good experience because in Texas, you kind of have that Southern hospitality. A lot of people say good morning and yes, ma'am.
Hi. Hello.
No, you didn't get that in New York, and I remember going into the clinic one of my first days saying, "Hey, good morning, ladies," and they looked at me like, "Good morning." What's so good about this? So I learned to kind of adapt in New York, and I felt very comfortable dealing with different personalities. And after the residency program, I was ready to practice. I was doing a little bit of part time in New York, but it was just very not cost effective to live in New York, So I decided to come back home to Texas. Worked for a couple practices as an associate, just kind of learning the business of dentistry. Um, and after a few years, I felt that I was comfortable to kind of step out on a limb and open my own office. So I came up with a business plan and, applied for financing. And I was approved, and I haven't looked back,
Wow.
So now the office has been open, as I said, since August of 2020.
Okay.
And we've been very busy since the doors opened. We've been getting a very good response from the community. just treating people the way they want to be treated, you know.
Mhm.
And so we'll get like a mom that'll come in for an exam and she'll have a great experience. The next thing you know, her friends are coming,
That's right.
husband, the kids are coming. And so it's just kind of this domino effect. And so at this point, I'm looking to, you know, expand a little bit within the same office, you know, but we're just growing. I'm hiring more staff members and I'm just been blessed. That's that's
Wow.
that's the summary how I got
So many questions. So, okay. First question is, so you did not finish undergrad in the normal 4 years, am I right?
there. Right. I did not
Okay.
traditional. I think it took 5.5. Yes, ma'am. When I should have been out, I was still in.
That's okay. And that's what
It- It's okay.
Armando, that's what people need to know. It's just there is no one pathway.
And you know,
You know?
the problem with me stopping and starting to work part-time is when I got a taste of that money coming in.
Mhm.
It's like, oh,
Mhm.
well, I'm not getting paid in college. Let me keep getting these few dollars an hour, not realizing that college is an investment. So that few dollars an hour can turn into a lot an hour if I
Right.
just do the work, you know, and get my education. So
Okay.
fortunately, I came back. You know, I didn't get caught up in the part-time working field.
And I've known people to do that. They feel like, "Oh, I need some money." So they'll work and then the money's good. So it's like, "Oh, let me work more, less school, work more, less school." So, just talk a minute. I like that word investment. Just talk a minute to, I guess that person who's feeling like, "Man, I really want to go to school, but I really, need the money." Or I mean, I know we can't solve the world's problem, but just what is your take on that? Because you were kind of choosing like, oh, the money's good. I think I'll just go to class a little bit less. Just talk to that person for a second.
Well, you have to look at the big picture, you know. Um, Money is good up front, but you have to think about long term. And, you know, I had to look at school as a job.
Mm-hmm.
You can't be discouraged by the cost of school. Let me just say that first and foremost. Fortunately, we live in a country where, yes, folks who have a little bit more money have different privileges, but we do have a variety of student government loans
Mm-hmm.
and financing available. And yes, professional school can seem like it costs a lot, but there are so many students who get their student loans, they go to school, they get their degree, and they start working as a professional, and they are able to pay that student loan and have a great lifestyle.
Mm-hmm.
That
Mm-hmm.
student loan doesn't last forever. And the thing about it is, you have a choice. You can get out and start living like a doctor and get a fancy car and a nice house, and you'll be paying on those student loans for a long time. Or you can get out and live modestly and pay those student loans down. And then you can, you know, do what you want to do. So in either scenario, there should be no reason why finances stops you from going to school. That's the first thing. The second thing is don't ever be discouraged by how challenging that it may seem. Because listen, not everybody who got into dental school was able to get through dental
Okay.
school. You have to want it.
Mm-hmm.
Okay. So I knew that if they were ever to let me in, there was going to be no way I wasn't going to get through this program, you know. So much so that I started volunteering for things. I wanted to be the class president, or class representative of this. I wanted to be involved because I knew that if I involved myself, there's no way that I could fall off. There are very smart people all the time who will get into professional school, but they don't finish. because they're not taking it seriously. They don't want it enough. Maybe they don't need it. Maybe they're already successful. Their parents are successful. And so what happens is you don't just get an automatic pass. You know, you have to study, you have to work hard. But that is honestly all it takes. If you want it, you can work hard and you can do
I
it. And
tell
I'm
my students, I need to get a shirt made, and hard work pays off. I mean,
absolutely
I just, I mean, I don't know any other way to put it. And, you know, talking from the teaching perspective, teaching is hard work. We deal with a lot of different personalities and just all sorts of things. I feel like we're not appreciated sometimes, and definitely our pay doesn't reflect what
right.
we do. But Armando, I've made up in my mind that I'm going to work hard for my students no matter what, and it'll pay off after a while. I think you've seen the award that I won, and just kind of like the little things that
Yes.
I've been blessed with, and that is um, the fruit of the hard work. Even when it was dark or it didn't seem like it, or nothing seemed to be on and popping and all of that. I mean, I just continue to work hard, and that award that I won, everyone can't say that. I mean, it was a long application, but I had to do the hard work of the long application.
Right.
I had to submit the lesson plan. you know I do feel like the YouTube channel and the songs that I've written and all of that helped, because it made me stand out as a candidate. But that was hard work. A lot of years of no one saying thank you, or some people thinking, "Oh, here she goes singing that science song again."
Yeah.
But that, hey, I'm aware proudly hard work pays off. And I'm not digressing, but what goes back to you are so successful and so many people are flooding your doors. I'm going to also use the word kindness and trust. And I also tell my students that as well. You cannot beat hard work, you cannot beat kindness. That's it.
Yeah.
Do those two things, nothing, I mean, there's nothing you can't do, you can't overcome. The people are flooding your doors because they trust you, because you're kind and you treated them nicely. You didn't try to get over on them. They're not going to refer people, if they feel slighted in any
That's
kind
right.
of way. So hard work and kindness, it definitely goes a long way. And you said one more thing about well, you said a lot, but one thing that's sticking out of my head right now is how you mentioned, the student loans and the living modestly or living like a doctor. That's a whole nother lesson, right?
It really is. It really is. But the point was, don't let finances stop you
Mhm.
from doing it. You can
Right.
you can do it. You
R-
just you just gotta want it. And believe,
Right.
trust that if you put in the work, nobody is better than you. Everybody's on the same playing field. Everybody has to put in the work. All right.
I teach pre-AP students, and to watch the dynamic of pre-AP students is very interesting. Um, the pre-AP class that I teach anyway is structured. It's not about the smart person. It's
Mm,
about the person who puts in the work. It's
yeah.
about, and our they don't, they have to learn more than what we had to learn when we were in high school.
Mm,
So I'm teaching students study skills now, and I tell them, like, when you get a hard class, you're going to need this. When because you may not need it for every class. So I
yeah.
try to teach them those study skills now when I talk to my future doctors and my future lawyers and my future dentists. And I say, when you get to a hard class, this is how you beat the hard class, by not studying 2 nights before the test, but by studying all the time. And, I get a lot of parent conversations. How can I help my child? Or, hey, the answer is always the same. Oh, can my child do pre-AP? Do they belong here? Yes, but they have to put in the work.
That's
That's
it.
it.
That's
That's
it.
it. Talk to is your mom a dentist? Is your dad a dentist? Do you come from a family of
No,
dentists or doctors? Or, I mean, if you
I
think about it, a lot of people may not have a connection or don't even know where to start. We still have students who come through that may be the first kid to graduate from high school.
yes,
We have kids to come through who may be the first I mean, my student teacher this semester, he was the first to graduate from college.
wow,
So talk to those students or those individuals who they will be the first, and they may feel lost or not know where to go. I mean, what are some things that they can do, to achieve those goals that they want to achieve?
absolutely. So I'm definitely the first doctor, first dentist in my family. Now, my parents did go to college, um, and they were always like, my father was always, he almost brainwashed me. He's like, "You'll be a doctor. You'll be a doctor. You'll
Speaking that positivity,
be a
yes.
doctor." And it's the mindset. You got to believe it. You have to believe it, and it is doable. So, um, the application process is very, very, very important because I didn't have to have the highest scores necessarily. Now, of course, there's standardized tests for
Mhm.
dental, there's DAT for medical, there's the
The MCAT, yeah.
And so what you need to be sure of is that we are approaching those standardized exams as if those are the gateways to what we want, because they are. If you can't do well on the exam, they won't even look at your application at those professional schools. So, and anybody can do it. They have so many prep books. You can go online. You can find them at Barnes and Nobles. For any standardized test, you will find a book that has like sample tests, so you can see what the test looks like beforehand. Or they have, different strategies for your weak areas to freshen up on. And if you can do well on that test, the other part is having a mentor, having somebody in the field that you can shadow. And I was saying to you before, I would be happy to mentor anybody or to allow anybody to come and shadow at my office. I'll be happy to set that up and schedule it. I'm in the business of pulling folks up,
Hmm.
you know, who need a hand and helping them get to where I'm at. And so, whether it's a recommendation letter
Hmm.
or whether it's just pointers, I'm definitely available. Um, the office is hashtag the smile doc, and my email is info@thesmiledoc.com. If you got
We'll
a,
make sure we'll like
yeah,
when I do the description, we'll like put the links and all of that in the description so people can make sure they connect.
yeah, but you don't have to be born with a silver spoon in your mouth
Mhm.
be able to be successful at whatever field or at whatever industry that you want. Okay. And
What
that's
would you
that's
tell your so a high school student? We'll talk to like a high school student. What would you tell a high school student, and then what would you tell the undergrad student, just about this process? I mean, hindsight is 2020. So I know that I was talking to another young lady, and she was saying, to get into medical school, they're looking at your undergrad. Well, to get into undergrad, they're looking at your high school. So how could we start to set students up for success starting at the high school level? What would you say?
well, I would definitely try to do my best to keep my GPA as high as possible because there's a lot of competition out there.
Hmm.
And so making sure that your GPA is up there will give you a great opportunity to get into undergrad. And that application process for undergrad is one of the more important application processes in your life. And so I think it's important to not put all your eggs in one basket, meaning look at multiple different schools, apply to multiple different schools, and don't just apply willy-nilly, but apply to a school that is going to give you what you need to get where you need to go. Okay. Not every school is built the same. Some have advantages and disadvantages. So um, making sure the GPA is great and getting out early in front of that application process. Don't wait till the last minute to look at undergraduate schools. You want to get out early. You can never plan too far ahead, if that makes sense.
Mhm.
And then the undergrad program, it really is a matter of what you want to do. So for dental school, for example, dental schools want you to have certain courses under your belt. And so right now, there are a couple programs out there where they will combine the courses that they need from undergrad with the graduate program. And so you don't necessarily need to spend, 4 years doing that, 4 years doing that. I think that the best strategy, if I could have done it again, was just look at what I need to become a dentist. What does the dental school want? I would look at that and say, okay, this is what I need for my undergrad program. And then that's how I would find what undergrad school that I'm going to go to. Is that,
Oh yeah, I for sure. Yeah, that's what we're looking for. I mean, just a variety of. I mean, I forgot all about those accelerated
mm,
programs that they have out there where they combine. It's just like you kind of. I mean, I was looking at them for medical school where you combine undergrad and grad, and it's just like a
right.
seamless transition. Now they're few and far
Mm,
between, so they are harder to get into. But I completely forgot about those, and I think that's a I mean, I know that, our high school kiddos, they're young, but it's okay to have a
yeah.
plan, and it's okay to change your mind. And our classmate Anitra, we were talking in another interview. She was just saying, just get out there and get experience, because you may get out there and decide that's not really what you want to
Mm,
do. So it's okay to get out and plan and say, "Oh, I want to do this," and go shadow this person or do this or do that, and then decide, "No, I changed my mind." The more experience, the
yeah.
better. And then I was just with the undergrad, how you were saying keep that GPA up high. You know, a good high GPA could also mean more money, which could also mean less loans, right?
Yeah. That's right. That's right. There are
I am.
plethora of scholarships out
Oh,
there.
I'm sorry. Go.
No,
Yes, I told my.
mm-hmm.
I told my kids, you need to be smart and or fast, or you need to be both, because
Both would be great, honestly. Yeah. Yeah.
right, right. I was fortunate enough to graduate with zero undergrad
Awesome.
loans, zero, and I mean, so when I don't understand, I don't know the
Mm.
struggle. It's all over the
Oh
news
yeah.
now, and not that I don't feel bad or but I just don't. I can't relate. I can't relate to pay student loans. I cannot relate, and that was a blessing
You were
that I
blessed.
didn't have to do that. Yeah.
I was not. I was not. I was, I was counting like, how much, what, how much is this loan? And I was
Fees for what?
in the
Fee, computer fees. I'm not even using the
store.
computer.
They got fees for everything. But God is able, and those student loans, they are reasonable. They keep the payments low, so it's it can seem overwhelming, but it's really not. It's really not. But
Right.
there's just so many opportunities for the ones who work hard. It's easier for you, okay, on the front end. And you get
Mhm.
through it faster, and it can be over faster, and you can get out there
Mhm.
faster. It's just like in high school. I actually did high school in 3 years, But
I did. Oh yeah, you were younger. I remember that now.
yeah, but I was going to summer school like almost every summer school. So I put in the extra time to get out a little bit early. So you just have to want it. And, that's all it takes is that effort, that work, like we were saying.
Right. It was some question that I had, and it totally escaped. Oh, speaking of investment, so you had to do student loans and whatever, whatever, and then now you had to invest in your practice.
Yes.
So just talk about. I mean, I guess it takes money to make money, or just the worth in that, and not being deterred by those things.
Yeah. So the practice was another loan, large loan on top of, another loan. So you have to look at it as a business is an investment that will keep on giving. You know, the the front end, yes, cost a lot. It's a lot of money, the equipment, the furniture, the decor, hiring employees, all of that adds up. But there's a reason why banks give business loans. Because
Yeah.
businesses make money. That's what they do. And so with the loans on top of the loans, I am still being very, very productive. I'm
Mhm.
productive where I can feed my family. I'm comfortable. I got a staff of 5 people, just hired to 6. I give monthly bonuses. We're not stressing about paying the rent. We're not worried about the lights. We look at the student loan as just one of the other bills, just like you have a light bill, the phone
Right.
bill, and you got the loan bill. And again, I'm only speaking encouragement. You can't let those numbers discourage you.
Right.
I think part of it is because I'm not used to having a lot of money or
Mm,
spending a lot of money,
mhm.
being in debt, but it's done every day, all the time. When you look outside at these houses, most of these people didn't pay cash for their house. They have a really big loan. We call it a mortgage.
That's right.
So if people can live in a house and not be a millionaire, for sure you can open your own business. And it's nothing better than being your own boss. Okay. Setting your own hours, doing things the way you want to do it, going home when you're ready to go home, taking your vacation. There's so many pros and benefits to doing it for yourself than not. You know?
I'm inspired. I am inspired. Oh my gosh. So Dr. Reed, you gave us great information. I mean, priceless, I would say. Just it I don't know how I'm going to roll out these interviews in which order, but you're the third, no, you're the fourth person. And just my professionals that I've interviewed, I'm just blown away. I mean, that the productivity, what you have accomplished, what you've put out there. Because I don't know. I think sometimes as humans, and especially as little humans, you just see the end result. You don't
Right.
see all of the work that was put into that. I mean, yes, they see you in your nice shirt, Dr. Reed, but I remember the village. You remember the village? I
Yeah.
mean, a lot of hard work goes into it, but again, that hard work pays off.
Yes.
um there's a quote that I found, and it's just like a little it's in my planner. And because I have dreams and I have goals and aspirations, even though they may be unique. Um and the saying is, just dream until your dreams come true.
Wow.
And it's just like, okay, because I get discouraged sometimes. It's just like, with the music, I love it and I know it works, but every once in a while it's like, oh, should I stop making music or should I keep going? Or is this lame? Is this corny?
Right.
And then I get a negative comment,
No,
but I
attention.
have to keep dreaming until that dream comes true, especially when you can't let it go. So I
Yeah,
really appreciate you just speaking to that, speaking to, the dreamers that are out there and, that first generation dentist or college student or high school graduate. And, and it's not all about higher education, right? I mean, there are successful people with no degrees.
absolutely. Absolutely. And I think the one thing that they all have in common, whether they have a degree or they don't, is what we've been saying. They just put in the work,
Hmm.
found what they wanted to do. They got laser focused and they went for it, you know.
Yeah.
And so, no matter how young or inexperienced, how disadvantaged you may be,
Mhm.
you can do it. You just got to put your mind to it.
That's right. We're gonna put all of Dr. Reed's info like in the description. And I also want you to leave some comments, leave some questions, anything that you put. If you don't contact him directly, I'll make sure I say, hey, Dr. Reed, you have this question or this. I mean, we are trying to get people elevated and motivated into those places where they want to go. I mean, sometimes it's just about making connections. Sometimes it's about getting a question answered. So we want to help with that. So what questions do you have? Look him up. He's offering it. So, make sure we take advantage of that. Did you want to say anything else, Dr. Reed?
Absolutely. As you said, I'm open. I'm willing to contribute and help in any way that I can. And I just want to thank you so much, Olivia, for having me. This has been great. I'm excited to look at the other interviews as well and just continue to reach back and help as many folks as we can. So thank you.
Yeah, each one reach one. If we could just reach one, I'm good. I'm good. Hopefully more, but if we could just help one person, then we've accomplished a lot. We
Yeah,
have.
did it.
All
Absolutely.
right. Well, I'm gonna stop our recording. You can tell
Bye.
them peace out, Dr. Reed.
Thanks so much.